What is the average length of a full-term pregnancy? Your options are 32 weeks, 36 weeks, 40 weeks or 44 weeks. The correct answer is C, that is 40 weeks. A full-term pregnancy typically lasts around 40 weeks, from the first day of the last menstrual period LMP to the estimated due date. Question number 2. Which hormone is responsible for initiating labor contraction? Your options are estrogen, progesterone, oxytocin or prolactin. The correct answer is C, that is oxytocin. Oxytocin is a hormone released by the pituitary gland that stimulates uterine contraction during labor. Question number 3. What is the purpose of the APGAR score? Your options are assessing maternal health, evaluating fetal heart rate, gauging newborn's well-being, or monitoring amniotic fluid levels. The correct answer is C, that is gauging newborn's well-being. The APGAR score is a quick assessment tool used to evaluate the physical condition of a newborn immediately after the birth. Question number 4. Which position is considered ideal for a baby during labor and birth? Your options are breech, transverse, vertex or face presentation. The correct answer is C, that is vertex. The vertex position, where the baby's head is down and ready for the birth, is considered the ideal position for a smoother delivery. Dear friends, welcome back to Dear Competitive Exam YouTube channel. Today, you are attending the 50 most important and most repeated MCQs question answers based on midwifery that everyone must know who are in the medical and nursing field. So get ready to challenge yourself. And friends, if this video is helping you, then make sure to hit that subscribe button below. Your support means world to us. So don't miss out. Hit subscribe now and let's keep the journey going together. Dear friends, there is one more announcement. Dear friends, as per your suggestions, we have started a new YouTube channel where we are conducting exam or assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. And the link of that channel has been given in the description. Let's continue. What is the primary role of a midwife during childbirth? Your options are performing surgical procedures, administering anesthesia, providing emotional support and care, or analyzing medical imaging. The correct answer is C, that is providing emotional support and care. Midwives play a crucial role in offering emotional support and care during pregnancy, childbirth and the postpartum period. Question number 6. Which prenatal test is commonly performed to assess genetic abnormalities in the fetus? Your options are amniocentesis, pap smear, urinalysis, or blood glucose test. The correct answer is A, that is amniocentesis. Amniocentesis involves collecting a small sample of amniotic fluid to analyze the fetal chromosomes and detect genetic abnormalities. Question number 7. What is the primary function of the umbilical cord? Your options are: oxygenate the mother's blood, connect the placenta to the uterus, transmit nutrients and oxygen to the fetus, or facilitate waste elimination from the mother. The correct answer is C, that is transmit nutrients and oxygen to the fetus. The umbilical cord acts as a conduit for transferring nutrients and oxygen from the mother to the developing fetus. Question number 8. Which stage of labor involves the actual birth of the baby? Your options are: first stage, second stage, third stage, or fourth stage. And the correct answer is B, that is second stage. The second stage of labor is characterized by the actual birth of the baby. Question number 9. What is the purpose of postpartum care? Your options are: preventing conception, monitoring fetal development, ensuring maternal recovery and well-being, or administering vaccinations to the newborn. The correct answer is C, that is ensuring maternal recovery and well-being. The postpartum care focuses on supporting maternal recovery, addressing physical and emotional changes, and promoting overall well-being. Question number 10. In the context of midwifery, what does the acronym GNM stand for? Your options are: General Nursing and Medicine, Graduated Nursing Management, General Nursing and Midwifery, or Gynecology and Neonatal Medicine. The correct answer is C, that is General Nursing and Midwifery. GNM stands for General Nursing and Midwifery, representing a nursing training program that includes both general nursing care and midwifery skills. Question number 11. What is the primary purpose of a prenatal ultrasound? Your options are: assessing maternal blood pressure, determining fetal gender, monitoring fetal development and well-being, or measuring amniotic fluid levels. The correct answer is C, that is monitoring fetal development and well-being. The prenatal ultrasounds are used to visualize the fetus, assess growth, detect anomalies, and ensure overall fetal well-being during pregnancy. Question number 12. Which condition is characterized by high blood pressure during pregnancy? Your options are: gestational diabetes, preeclampsia, ectopic pregnancy, or placenta previa. And the correct answer is B, that is preeclampsia. Preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to organs, often affecting the liver and kidneys. Question number 13. What is the primary function of the placenta during pregnancy? Your options are producing hormones for fetal development, providing a barrier to infections, filtering waste from the maternal bloodstream, or facilitating nutrient and oxygen exchange. The correct answer is D, that is facilitating nutrient and oxygen exchange. The placenta is responsible for exchanging nutrients, oxygen and waste products between the maternal and fetal circulations. Question number 14. During which stage of labor is the placenta expelled from the uterus? Your options are first stage, second stage, third stage, or fourth stage. The correct answer is C, that is third stage. The third stage of labor involves the expulsion of the placenta, which occurs after the baby is born. Question number 15. Which factor is not considered a potential risk for a high-risk pregnancy? Your options are maternal age, multiparity, having multiple pregnancies, adequate prenatal care, or pre-existing medical conditions. The correct answer is C, that is adequate prenatal care. The adequate prenatal care is essential for a healthy pregnancy and is not a risk factor, but a protective factor in promoting maternal and fetal well-being. Question number 16. Dear friends, there is one more announcement. Dear friends, as per your suggestions, we have started a new YouTube channel where we are conducting exam or assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. And the link of that channel has been given in the description. Let's continue. What is the primary purpose of the Leopold maneuvers during prenatal care? Your options are assessing fetal heart rate, determining fetal position and presentation, monitoring uterine contractions, or measuring maternal blood pressure. Answer is B, that is determining fetal position and presentation. Leopold maneuvers involve palpating the mother's abdomen to assess the position and presentation of the fetus, aiding in determining the optimal delivery approach. Question number 17. Which of the following is the common method for pain relief during labor? Your options are epidural anesthesia, antibiotic therapy, intravenous fluids, or oxygen therapy. The correct answer is A, that is epidural anesthesia. Epidural anesthesia is a common method used to provide pain relief during labor by numbing the lower half of the body. Question number 18. What is the primary purpose of the vernix caseosa? Your options are providing insulation for the fetus, aiding the fetal movement, lubricating the birth canal, or protecting the fetus skin during development. And the correct answer is D, that is protecting the fetus skin during development. The vernix caseosa is a waxy substance that protects the fetus skin from amniotic fluid, preventing it from drying out. Question number 19. What is the primary role of the midwife during the antenatal period? Your options are monitoring fetal heart rate, administering vaccination to the newborn, providing care and education to the pregnant woman, or assisting with the delivery process. The correct answer is C, that is providing care and education to the pregnant woman. During the antenatal period, midwives play a crucial role in providing care, support and education to the pregnant woman. Question number 20. Which condition involves the abnormal implantation of the placenta over the cervical opening? Your options are placenta accreta, placenta previa, ectopic pregnancy, or gestational diabetes. The correct answer is B, that is placenta previa. Placenta previa is a condition where the placenta partially or completely covers the cervix, increasing the risk of bleeding during pregnancy. What is the primary purpose of the Bishop score in obstetrics? Your options are assessing fetal heart rate, evaluating the readiness of cervix for labor induction, monitoring amniotic fluid levels, or measuring maternal blood pressure. The correct answer is B, that is evaluating the readiness of the cervix for labor induction. The Bishop score is used to assess the cervix's readiness for labor induction by considering factors such as cervical dilation, effacement and fetal station. Question number 22. Which stage of labor is characterized by the delivery of the placenta? Your options are first stage, second stage, third stage, or fourth stage. The correct answer is C, that is third stage. The third stage of labor involves the delivery of the placenta after the birth of the baby. Question number 23. What is the primary purpose of the electronic fetal monitoring EFM during the labor? Your options are assessing maternal blood pressure, monitoring uterine contractions, measuring fetal weight, or administering pain relief. The correct answer is B, that is monitoring uterine contraction. EFM is used to monitor uterine contractions and the fetal heart rate during labor, providing valuable information about the well-being of the fetus. Question number 24. Which childbirth position is associated with the reducing perineal trauma? Your options are supine position, lithotomy position, squatting position, or Trendelenburg position. The correct answer is C, that is squatting position. The squatting position during childbirth is associated with a reduced risk of perineal trauma and may facilitate the birthing process. Question number 20. What is the primary purpose of the non-stress test NST during prenatal care? Your options are assessing maternal blood pressure, monitoring fetal heart rate in response to movement, measuring amniotic fluid levels, or checking for maternal infections. The correct answer is B, that is monitoring fetal heart rate in response to movement. The non-stress test NST assesses the fetal heart rate in response to fetal movement, providing information about fetal well-being. Question number 26. Which condition involves the premature separation of the placenta from the uterine wall? Your options are placenta accreta, placenta previa, ectopic pregnancy, or abruptio placentae. The correct answer is D, that is abruptio placentae, is the premature separation of the placenta from the uterine wall, leading to potential complications for both mother and the fetus. Question number 27. During which stage of a labor does cervical dilation typically occur? Your options are first stage, second stage, third stage, or fourth stage. The correct answer is A, that is first stage. Cervical dilation occurs during the first stage of labor, which is further divided into the latent and active phases. Question number 28. What is the primary role of the amniotic fluid during pregnancy? Your options are cushioning the fetus, providing nutrition to the mother, regulating maternal hormones, or initiating labor contractions. And the correct answer is A, that is cushioning the fetus. Amniotic fluid cushions and protects the fetus within the amniotic sac, providing a supportive environment. Question number 29. Which maneuver is performed to resolve shoulder dystocia during childbirth? Your options are Mack-Roberts maneuver, Leopold maneuver, Ridgen maneuver, or Zvanili maneuver. The correct answer is A, that is Mack-Roberts maneuver. The Mack-Roberts maneuver involves flexing the mother's legs toward her abdomen to alleviate shoulder dystocia during childbirth. Question number 30. What is the primary purpose of the biophysical profile BPP in antenatal care? Your options are assessing maternal blood pressure, monitoring fetal heart rate, evaluating fetal well-being through various parameters, or measuring amniotic fluid levels. The correct answer is C, that is evaluating fetal well-being through various parameters. The BPP, that stands for Biophysical Profile, assesses fetal well-being by evaluating factors such as fetal movements, breathing, muscle tone, amniotic fluid levels, and non-stress test results. Question number 31. Dear friends, there is one more announcement. Dear friends, as per your suggestions, we have started a new YouTube channel where we are conducting exam or assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. and the link of that channel has been given in the description. Let's continue. Which hormone is responsible for maintaining the uterine lining during pregnancy? Your options are estrogen, progesterone, oxytocin, or prolactin. The correct answer is B, that is progesterone. Progesterone plays a crucial role in maintaining the uterine lining and supporting the early stages of pregnancy. Question number 32. What is the primary function of the fontanellus in newborn skull? Your options are allowing for skull compression during birth, facilitating fetal movement, enhancing the sense of touch, or regulating body temperature. The correct answer is A, that is allowing for skull compression during birth. Fontanelles are soft spots on a newborn skull that allow for skull compression during birth, facilitating passage through the birth canal. Question number 33. During which trimester of pregnancy does the fetal heartbeat become audible using a Doppler device? Your options are first trimester, second trimester, third trimester, or fourth trimester. The correct answer is B, that is second trimester. The fetal heartbeat becomes audible using a Doppler device during the second trimester. Question number 34. What is the primary function of the Montgomery glands in the breast during pregnancy? Your options are producing colostrum, regulating maternal hormones, facilitating fetal movement, or lubricating the nipples. The correct answer is D, that is lubricating the nipple. Montgomery glands secretes oils that lubricate the nipples and aid in breastfeeding. Question number 35. Which stage of labor is associated with the delivery of the baby's head and shoulder? The options are first stage, second stage, third stage, or fourth stage. The correct answer is B, that is second stage. The second stage of labor involves the delivery of the baby's head and shoulders. Question number 36. What is the primary purpose of the Rubin maneuver during childbirth? The options are facilitating the fetal descent, resolving shoulder dystocia, assisting with breech delivery, or evaluating cervical dilation. The correct answer is A, that is facilitating fetal descent. The Rubin maneuver helps to facilitate the fetal descent by encouraging rotation and positioning. Question number 37. Which hormone stimulates milk ejection during the breastfeeding? Your options are estrogen, progesterone, oxytocin, or prolactin. The correct answer is C, that is oxytocin. Oxytocin is responsible for the milk ejection reflex during breastfeeding. Question number 38. What is the primary purpose of the Rubin maneuver during childbirth? The options are facilitating fetal descent, resolving shoulder dystocia, assisting with breech delivery, or protecting the perineum. And the correct answer is D, that is protecting the perineum. The Rubin The region maneuver is used to protect the perineum during the delivery, reducing the risk of tearing. Question number 39. During which prenatal test is a sample of the chorionic villi taken for genetic analysis? Your options are amniocentesis, chorionic villus sampling CVS, non-invasive prenatal testing NIPT, or glucose tolerance test. The correct answer is B, that is chorionic villus sampling. CVS involves taking a sample of chorionic villi for genetic analysis during pregnancy. Question number 40. What is the primary purpose of the Schell's mechanism during placental delivery? Your options are facilitating fetal descent, resolving shoulder dystocia, assisting with the breech delivery, or expelling the placenta with fetal side first. The correct answer is D, that is expelling the placenta with the fetal side first. The Schell's mechanism involves the placenta detaching and being expelled with the fetal side first. Which type of pelvis is considered favorable for a smooth vaginal delivery? Your options are gynecoid, android, anthropoid, or platyploid. The correct answer is A, that is gynecoid. The gynecoid pelvis is considered favorable for a smooth and uncomplicated vaginal delivery. Question number 42. Dear friends, there is one more announcement. Dear friends, as per your suggestions, we have started a new YouTube channel where we are conducting exam or assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. And the link of that channel has been given in the description. Let's continue. What is the primary function of the Zavanelli maneuver during childbirth? Your options are facilitating fetal descent, resolving shoulder dystocia, assisting with the breech delivery, or relocating the fetus into the uterus. The correct answer is D, that is relocating the fetus into the uterus. The Zavanelli maneuver involves attempting to return the fetus into the uterus to perform a cesarean section. Question number 43. Which prenatal test is commonly used to assess neural tube defects into the fetus? Your options are amniocentesis, chorionic villus sampling CVS, alpha fetoprotein AFP test, or non-invasive prenatal testing NIPT. The correct answer is C, that is alpha fetoprotein test AFP. The AFP test measures the levels of alpha fetoprotein in maternal blood to screen for neural tube defects. Question number 44. What is the primary purpose of the Mack-Roberts maneuver during childbirth? Your options are facilitating fetal descent, resolving shoulder dystocia, assisting with the breech delivery, or aiding in the delivery of the posterior shoulder. The correct answer is B, that is resolving shoulder dystocia. The Mack-Roberts maneuver is used to resolve shoulder dystocia during childbirth. Question number 45. Which hormone is responsible for maintaining the uterine lining and supporting early pregnancy? Your options are estrogen, progesterone, oxytocin, or prolactin. The correct answer is B, that is progesterone. Progesterone maintains the uterine lining and supports the early stages of pregnancy. Question number 46. What is the primary role of the SROM, spontaneous rupture of membranes, during labor? Your options are initiating uterine contraction, facilitating the fetal descent, allowing the release of amniotic fluid, or inducing maternal sleep. The correct answer is C, that is allowing the release of amniotic fluid. The SROM involves the spontaneous rupture of membranes leading to the release of amniotic fluid, often signaling the onset of labor. Question number 47. Which stage of labor involves the delivery of placenta and membranes? Your options are first stage, second stage, third stage, or fourth stage. The correct answer is C, that is third stage. The third stage of labor involves the delivery of the placenta and membranes. Question number 48. What is the primary purpose of the Ballard score in neonatal care? Your options are assessing maternal blood pressure, evaluating neonatal respiratory function, monitoring neonatal blood glucose levels, or determining gestational age. The correct answer is D, that is determining gestational age. The Ballard score is used to estimate gestational age in newborns based on physical and neuromuscular characteristics. Question number 49. What is the primary purpose of the Fern test during pregnancy? Your options are evaluating fetal movement, assessing amniotic fluid leakage, monitoring maternal blood pressure, or measuring fetal heart rate. The correct answer is B, that is assessing amniotic fluid leakage. The Fern test helps to confirm the rupture of membranes by examining amniotic fluid for characteristic Fern-like patterns. Question number 50. Which fetal position is considered optimal for a smooth delivery? Your options are right occiput transverse (ROT), left occiput anterior (LOA), right occiput posterior (ROP), or left occiput transverse (LOT). The correct answer is B, that is left occiput anterior (LOA). LOA position, where the baby's head is down facing the mother's spine, is considered optimal for a smooth delivery. Question number 51. What is the primary purpose of the nitrazine test in obstetrics? Your options are evaluating fetal movement, assessing amniotic fluid leakage, monitoring maternal blood pressure, or measuring fetal heart rate. The correct answer is B, that is assessing amniotic fluid leakage. The nitrazine test is used to detect amniotic fluid in cases of suspected rupture of membranes. Question number 52. Which condition involves the implantation of the fertilized egg outside the uterus? Your options are ectopic pregnancy, placenta previa, abruptio placentae, or gestational trophoblastic disease. The correct answer is A, that is ectopic pregnancy. Ectopic pregnancy occurs when the fertilized egg implants outside the uterus, typically in the fallopian tube. Question number 53. What is the primary purpose of the lecithin sphingomyelin ratio in fetal lung maturity testing? Your options are evaluating fetal movement, assessing amniotic fluid leakage, monitoring maternal blood pressure, or predicting fetal lung maturity. The correct answer is D, that is predicting fetal lung maturity. The LS ratio, lecithin sphingomyelin, assesses the maturity of fetal lungs by comparing the levels of lecithin to sphingomyelin in amniotic fluid. Question number 54. What is the primary role of the vernix caseosa on a newborn's skin? Your options are providing insulation for the fetus, preventing dehydration of the fetus, lubricating the birth canal, or protecting the skin during development. The correct answer is D, that is protecting the skin during development. Vernix caseosa protects the newborn skin from the amniotic fluid, preventing it from drying out. Question number 55. Which hormone stimulates milk production in the mammary glands? Your options are estrogen, progesterone, oxytocin, or prolactin. The correct answer is D, that is prolactin. Prolactin is the hormone responsible for stimulating milk production in the mammary glands. Question number 56. What is the primary function of the foramen ovale in the fetal circulation? Your options are oxygenating the fetal blood, transporting nutrients to the fetus, shunting blood from the right atrium to the left atrium, or filtering waste products from the fetal bloodstream. The correct answer is C, that is shunting blood from the right atrium to the left atrium. The foramen ovale allows blood to bypass the lungs by shunting from the right atrium to the left atrium in fetal circulation. Question number 57. During which stage of labor is the cervix fully dilated? Your options are latent phase, active phase, transition phase, or explosion phase. The correct answer is C, that is transition phase. The transition phase marks the full dilation of the cervix and is the final stage of the first stage of labor. Question number 58. What is the primary purpose of the nitric oxide NO test in the obstetrics? Your options are evaluating fetal movement, assessing amniotic fluid leakage, monitoring maternal blood pressure, or predicting preterm labor. The correct answer is D, that is predicting preterm labor. The nitric oxide test is used to predict the risk of preterm labor by measuring nitric oxide levels in the cervical mucus. Question number 59. What is the primary function of the cervical mucus plug during pregnancy? The options are initiating uterine contraction, protecting the fetus from the infections, facilitating the fetal movement, or sealing the cervix to prevent infections. The correct answer is D, that is sealing the cervix to prevent infection. The cervical mucus plug seals the cervix, acting as a barrier to prevent infection from ascending into the uterus during pregnancy. Question number 60. Which term refers to the cessation of uterine contractions between contraction during labor? The options are uterine atony, uterine tetany, uterine diastasia, or uterine relaxation. The correct answer is B, that is uterine tetany. Uterine tetany is a term used to describe the continuous tension or lack of complete relaxation between uterine contraction during the labor. So dear friends, it's the time to comment your score, and if the video was helpful, then please comment your view on this video. Dear friends, there is one more announcement. Dear friends, as per your suggestions, we have started a new YouTube channel where we are conducting exam or assessments based on science topics. I'm sure that those videos will help you a lot to prepare for upcoming science or medical, even NEET exams, where we help you to gain knowledge and confidence attending plenty quizzes based on science and NEET exams. If you really want to know how confident you are in the science and medical exams, then please visit and attend the test over there. And the link of that channel has been given in the description. And do support us by liking and subscribing and sharing our channel, our videos. So thank you so much for watching and wish you good luck for your upcoming exams.